Right, darling, let's talk about something a lot of you men are wondering, especially those of you in your 50s, 60s, and beyond. It's a question that gets whispered in online forums, typed into late-night Google searches, but rarely said out loud to your doctor. What happens to my prostate if I masturbate every day? You've probably heard all kinds of scary stories, that it damages your prostate, causes inflammation, or even increases your risk of prostate cancer. These ideas can make a man feel ashamed about something as natural as self-pleasure. But I'm here to tell you something that might surprise you. I've been working in the field of aging and sexual health for nearly 2 decades. And today, I want to share the real, science-backed truth. The answer is genuinely surprising, and almost certainly not what you've been led to believe. So, sit back, breathe easy, and stay with me, because the truth, yes, the shocking, hopeful truth, may change how you think about your own body forever. To understand this, we have to start with the star of the show, the prostate gland. What exactly is it? The prostate is a small gland, about the size of a walnut, located just beneath the bladder and in front of the rectum. Its main job is to produce and store the fluid that makes up a significant portion of semen. That fluid carries and nourishes sperm during ejaculation. But the prostate isn't just some plumbing part. It's deeply tied to a man's vitality, confidence, and health. As we age, it becomes even more important, and unfortunately, more vulnerable. This is where the myths begin. You've likely heard claims that frequent masturbation wears out the prostate, causes chronic inflammation called prostatitis, or somehow increases your risk of prostate cancer. These fears aren't just unscientific, they're deeply rooted in shame, outdated beliefs, and moral judgments disguised as medical advice. For decades, these ideas circulated unchecked. But then, something remarkable happened. Now, let's talk about the science, the real science. At Harvard University, one of the world's most respected research institutions, scientists at the Th Chan School of Public Health decided to put these prostate myths to the test. They didn't rely on old assumptions or internet rumors. No, they launched one of the largest and longest studies on male sexual health ever conducted. This study followed nearly 32,000 men, not for a few months, but for almost 2 decades. These men regularly reported details about their lifestyle, health, and yes, their ejaculation frequency, including both sex and masturbation. And when the researchers analyzed the data, they discovered something absolutely stunning. Men who ejaculated more frequently, specifically 21 times or more each month, had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times a month. Did you hear that, my darling? Not only did frequent ejaculation not increase the risk, it actually seemed to offer a protective effect. These results shocked the scientific community and turned decades of fear-based thinking on its head. This wasn't just one random result. Similar findings came from an Australian study, further reinforcing the link between regular ejaculation and reduced prostate cancer risk. But why? Why would something as simple as regular release protect one of the most sensitive glands in your body? Let's explore the science behind that. There are 3 main theories behind the benefits of ejaculation. Scientists have a few strong theories, and I'll walk you through the top 3. These are the most widely supported, and they make a lot of sense. 1. The prostate flush effect, also called the prostate stagnation hypothesis. Think of your prostate like a system of tiny pipes. If fluids and old cells just sit there too long, they can become toxic or irritating. Frequent ejaculation helps flush these pipes, clearing out built-up fluid, potential carcinogens, and dead cells before they can cause trouble, like cleaning the gutters before they clog. Number 2. Healthier cellular turnover. Every time a cell replicates, there's a tiny chance of a mutation. Over time, mutations can lead to abnormal growth, cancer. By encouraging healthy, regular function in the prostate through ejaculation, you may reduce the number of stressed or aging cells hanging around. It's like spring cleaning for your glandular tissue. 3. Reduce stress and inflammation. Chronic inflammation is a known risk factor for cancer, and stress can raise inflammation levels across the body. Ejaculation, particularly through masturbation, can help release physical tension and trigger a wave of feel-good hormones that calm the nervous system. That emotional release may also help reduce internal inflammation. So, when you put it all together, daily or frequent ejaculation becomes more than a pleasure. It becomes a powerful tool for maintaining internal balance, reducing inflammation, and supporting long-term prostate health. But that's not all. Now, my darling, let's talk about something I know many of you are dealing with quietly, and maybe even with some embarrassment, waking up 2, 3, even 4 times a night just to pee. That lingering feeling like you can never fully empty your bladder. A weak stream that takes forever. That urgent pressure, but nothing really comes out. It's frustrating. It's exhausting. And it starts to wear on your confidence. These symptoms are incredibly common in older men and are often linked to something called benign prostatic hyperplasia, or BPH for short. It's a non-cancerous enlargement of the prostate that happens with age. As the gland grows, it can start to squeeze the urethra, the tube that carries urine, and that's where the trouble begins. Now, here's where things get really interesting. While masturbation won't shrink an already enlarged prostate, the act of ejaculation may help reduce fluid buildup and temporary swelling in the gland. It's like letting the steam out of a pressure cooker. In some men, this helps reduce the feeling of congestion or tightness in the pelvic area and improves urine flow, at least for a short while. I've had many older male patients over the years tell me that they actually feel relief in their urination or pelvic comfort after they ejaculate. Now, let's be clear, this isn't a guaranteed fix, and it won't replace proper medical treatment if you have moderate to severe BPH. But if your symptoms are mild and you're looking for gentle, natural ways to feel better, this simple daily practice could offer some real relief. And it's not just about peeing more freely. There's an emotional benefit, too. When you take time each day, even just a few minutes, to be in tune with your body, to connect with it through touch and relaxation, it signals to your nervous system, hey, we're okay. You're safe. You're still alive. You still feel good. That kind of connection is powerful. It can help reduce anxiety, calm racing thoughts, and restore a sense of control. And in case no one has told you this lately, you deserve to feel that kind of peace. But I know what you might be thinking. You're asking, is it really okay to masturbate every day at my age? What if I have a heart condition or diabetes? Will it deplete my energy? These are very good questions. Thank you for staying with me, darling. Now, let's gently open the next door of understanding, because there's a lot of misinformation out there about what daily ejaculation does to your energy, hormones, and emotional state, especially for men in their 60s, 70s, and beyond. Let's start with energy. Some people worry that daily masturbation will make you tired, drained, or sluggish. But here's the truth, occasional tiredness after orgasm is completely normal. That's due to a temporary dip in certain neurochemicals like dopamine and prolactin that help your body shift into rest mode. However, if your overall lifestyle includes healthy food, movement, hydration, and sleep, daily ejaculation won't harm your energy levels. In fact, for many men, it does the opposite. It helps them sleep better, wake up feeling less tense, and move through their day with more ease. Next, let's talk about hormones, especially testosterone. One of the biggest myths floating around is that masturbation depletes testosterone or makes you less manly. I can't stress this enough, that's simply not true. Multiple studies, including one from the European Urology Journal, have shown that regular ejaculation does not cause a long-term drop in testosterone. In fact, testosterone levels may temporarily rise in the hours after arousal and orgasm. And maintaining healthy sexual activity, even solo, is associated with better hormonal regulation over time. Now, if you're feeling chronically exhausted, low in motivation, or have difficulty with erections, it may not be your masturbation habit. It could be something deeper, like low T, testosterone deficiency, poor circulation, or metabolic issues. And that's where speaking with a specialist like a urologist or an endocrinologist can make a big difference. And now we come to your mood, an area I care deeply about. In my experience, daily self-pleasure, when done mindfully and without shame, can help reduce depression, anxiety, and irritability. Why? Because ejaculation triggers the release of oxytocin, serotonin, dopamine, all the feel-good chemicals your brain loves. This doesn't mean it's a replacement for deeper emotional support, relationships, or therapy. But it does mean that this simple act can become part of your emotional self-care toolkit, like journaling, meditating, or stretching. One of my older patients, let's call him Sam, age 73, told me, "Dr. Anya, I started doing it just to sleep better, but now it's become a part of how I reconnect with myself. It's grounding. It reminds me that I'm still here, still a man." Isn't that beautiful? So, no, daily masturbation doesn't steal your energy, wreck your hormones, or ruin your mood. Done gently, it can be a pathway to balance, clarity, and strength. Next, I'll guide you through a simple, respectful daily routine for prostate-friendly self-care designed for older men like you. Alright, darling. Now that we've cleared the myths and looked at the real science behind daily ejaculation, let's talk about how to actually make it part of a healthy, respectful daily routine. This is especially important for older men, because your body's needs change. Sensitivity, stamina, skin condition, and comfort all evolve over time. So, we adapt with grace. Here's a simple step-by-step routine I teach my clients. It's respectful, gentle, and supportive of both your prostate health and your emotional balance. Step 1. Set the mood. Respect yourself. Don't just sneak off and rush. Instead, create a calm space, just like we discussed in our 30-day vitality journey. Dim the lights, sit or lie somewhere comfortable. Put your phone away. This moment is for you. Play soft music if you like, or simply breathe quietly. Why does this matter? Because relaxation triggers your parasympathetic nervous system. That's the rest and digest system that supports blood flow, hormone balance, and overall emotional calm. Step 2. Gentle warm-up. Prime the circulation. Spend 1 or 2 minutes breathing deeply. Place a warm towel on your lower abdomen or inner thighs to relax the surrounding muscles. This warmth increases pelvic circulation, which we now know is essential for prostate health and erectile function. If you learn light massage in our earlier sessions, great. Spend 30 seconds doing slow, circular strokes on the pelvic area to awaken sensation gently. Step 3. Mindful stimulation. No rushing. Whether you're using your hand or a soft aid like a stroking sleeve, start gently. Use hypoallergenic oil or a natural lubricant to avoid friction, especially if you have thinner, aging skin. Start slow. Pause often. This isn't about finishing fast. This is about staying in tune with how your body feels. If you're able to reach climax, wonderful. If not, don't worry. The point is not the orgasm itself. It's the connection, the relief, the circulation, and the pleasure. Step 4. Aftercare. Treat your body kindly. Once you're done, take a moment to clean up with warm water and mild soap, especially if you're using oil. Dry gently, don't rub. Then, hydrate. A glass of water helps your body flush out remaining secretions. Some men like to stretch, journal, or simply rest for 5 minutes after. And here's my favorite closing ritual. Place a hand on your belly and say to yourself, "I'm taking care of myself, because you are, and that matters." Daily, weekly, or just sometimes, let me be clear, there's no perfect number. If you enjoy solo pleasure daily and it makes you feel better, it's okay. If 3 times a week feels right, that's also okay. There's no shame, no scoreboard, just self-respect. Listen to your body. Let pleasure be one ingredient in your wellness, not the whole recipe. Let's wrap this up together. The truth is, many men in their 60s, 70s, and beyond carry guilt, fear, or confusion around this very natural part of their lives. You don't need to. Not anymore. You're not broken. You're not dirty. You're not too old. You are a man with a body that still deserves care, attention, and yes, pleasure. So, if this video helped change the way you see yourself, I'd be honored if you subscribed and click the bell. It tells me you're ready for more honest, respectful, science-backed conversations about men's health. And now it's your turn. What questions do you have about aging and sexual wellness? Drop them in the comments. I'll be reading them. And I'll see you in the next video. Stay gentle. Stay strong. This is Dr. Anya signing off with love.